Hi, good afternoon. My name is Bhadelia. I'm an infectious diseases physician and the founding director of Boston University's Center on Emerging Infectious Diseases. I'll be your MC today. And you're here for CEID's semi-annual symposium, which today will focus on climate crisis and the future of infectious diseases. Today's symposium is part of CEID's partnership with Boston's Museum of Science. A few weeks ago, as I was reflecting today about writing these remarks, I was thinking back to a few weeks ago when I was at a security conference, brought together experts looking at threats to humanity and our world. Everything from climate change to nuclear proliferation, the advent of AI, synthetic biology, and of course, a subject close to our hearts, pandemics. And a younger colleague at the workshop turned to others and said, have things always been this bad? Or do they seem particularly bad right now? Is this cyclical? Or is something inherently changing? And the resounding consensus was that we are in a pivotal moment in human history where we have a confluence of crises that threaten to unravel decades of progress. The climate crisis is not in the future. It is no longer a threat that is distant on the horizon. It is here. And for us, as we experience it at our center, it is a health crisis. The warming of our planet is not just melting glaciers and rising sea levels. It is creating new breeding grounds for pathogens and expanding the reach of vectors. It's affecting food sources, shelter sources, water sources for humanity. And it's undermining the very foundations of public health. Numbers are pretty stark. There's a landmark study in 2022 in Nature Climate Change that said about 58% of known human pathogenic diseases are aggravated by climate change. That's about half the diseases that we have experience with that are now being amplified by this crisis. The WHO projects that between 2030 and 2050, climate change will cause additional 250,000 deaths from malnutrition, malaria, diarrhea, and heat stress alone. So it's not a distant projection. It's happening now. And over the last year, when you look at things that are happening in the world of infectious diseases, it's become resoundingly clear. In Central and South America, over the last year, we've seen a 65-fold increase in yellow fever cases. This year, New York State reported its first locally transmitted infection of chikungunya, a mosquito-borne virus due to a mosquito that about 10 years ago would not have been able to survive in that climate. At the same time, many other countries have noted the same kind of appearance of mosquito-borne viruses. And what we're seeing is a global pandemic from that disease. But this is not just a story about numbers and statistics. It is a story about people. Because the people who carry the burden of the crisis and who are most heavily affected by it are actually those that contributed the least to it. And that is why we're here today. This symposium is not just an academic exercise. It is a call to action. It is a recognition that we need a new paradigm for global health and for the current upcoming challenge of evolving infectious diseases threats. And that is why I am so happy that we have an incredible group of speakers and panelists who will be bringing the issue to life for us. First, I'm going to tell you a bit more about the format of the event. I will pretty soon turn over the podium to Tim Ritchie, the president of Museum of Science, who is a partner, as I mentioned, in today's event. And then we will have introductory remarks from Senator Markey. As you can notice, the senator is not here. Unfortunately, at last minute, they had to switch to virtual participation because I don't know if you've heard, there's a couple of things going on in our government currently. We will then have a panel, and then we'll have an incredible keynote address from Dean Adil Najam, the president of the World Wildlife Fund. So why don't I start by calling up Tim, but before I do, let me introduce Tim Ritchie, who's the Gwyl York president of Boston's Museum of Science. Under his leadership, the museum has expanded its impact to the world, reaching over 320 million people last year. Tim is a lawyer by training, and he has devoted his career to expanding opportunity and unlocking human potential. As a lawyer, he served clients on death row and in a poverty law clinic. He left his practice to launch education programs in the largest public housing community in Birmingham, Alabama. He went on to lead a nonprofit in Louisville, Kentucky that served adults with developmental disabilities. And since 2004, he has led science centers across the country, including the McWane Science Center in Birmingham, the Tech Interactive in San Jose, California, and now, of course, the Museum of Science. Tim, all yours.
Well, it is such a pleasure and honor to be here. BU has been such a great partner with and to the Museum of Science, and AHID has really been there right from the beginning. I actually came to the Museum of Science in February of 2020. And one of the first people I had to meet was our center, well, he wasn't the center director, there was David Sittenfeld, who's here right now. David, if you could wave your hand. David is now the director of our Center for the Environment. But the COVID crisis begged for a community conversation. And David had sponsored so many of these conversations about how science and the community needed to talk to each other. And when I said, David, you've got to put on this program, this town hall that we can do about COVID. We have to be there for our community. Nahid was the first person he called. And she was clearly one of the stars of the show as we tried to make things happen and bring our community together to face the vaccine. I mean, the pandemic, which then became the great hope that we had in this vaccine. It is a gift to be here also among so many people who are committed to doing something about the challenges we face in infectious diseases. And that's just a smaller part of this larger question about how we're going to look at reality itself. The great challenge is, will we look at reality as embedded with hope, or will we look at reality through ideological lenses? We know what it looks like when we look at reality through an ideological lens. And the answer is not good. We know what it's like when we look at reality as what it is, full of evidence and full of this sense that humanity has what it takes to rise up to the challenges we face. Oh, by the way, Leo Liu, who's on our board, who is also associated with BU, just walked in, so thank you, Leo, for coming. So the connections with BU are strong, so science looks for answers for sure, but science at its best is also what's here. Science at its best is also the building of community. The building of community around an idea. The idea is the answers are out there. That we have to be, in the words of Christina Figueres, stubbornly optimistic. Optimism with evidence. But it even goes beyond that. There's this sense, once again, of the embeddedness of hope in reality itself, that we have the abundant way to solve these problems, but of course we have to face up to them. Now, he was talking about the challenge we're facing. Is it different than it's ever been before? One way it's different than it's ever been different before is the problem of speed. The climate is changing faster than ever before. The population is growing faster than ever before, and the diseases are moving faster than ever before as the climate warms. That's a fact. The question is, can we move with speed as well? I'm going to trust the panel to handle that. I do want to talk with you a little bit about the Museum of Science. We exist to help people love and trust science. That's why we exist. Our audience is the general public. But the way we do that is in forums like this, and then eventually in our own public science common. And what we do now is to have people in a room representing, if you could think of a four-leaf clover, academia, industry, the general public, and academia, industry, the general public, and the fourth one. What am I missing, David? Industry, of course. Industry, sorry. So when you get all four of them together, we can think out loud about what kind of world we want. But once again, we have to think out loud, not through ideological lens, but through the lens of reality itself. That's what's happening here. That's what will happen there. That's why we're so proud of being partners with Boston University. No one has been better at tying these two stories together between climate change and public health than Senator Ed Markey. We know that it's one story. It's not two stories. The health of the planet and the health of individuals is one story. But what it seems so obvious to us in this room is not obvious to the world. In fact, it's not obvious at all. So Senator Markey has been out there promulgating legislation to tie the things together for years. He has not had that much success. But eventually, reality gets the last word. I just hope that we can catch up before reality has a really bad last word. So with that, I'd like to have us turn our attention to Senator Ed Markey as we sort of celebrate his advocacy to put these two stories into one story, and then, of course, to challenge our nation, to challenge our world to do something about it. Thank you, everybody.
Hello, everyone. I'm Senator Ed Markey, and I am thrilled to join you virtually for Boston University's Fall Symposium on the Climate Crisis and the Future of Infectious Diseases. So thank you again to Boston University for hosting this important event. Climate change is the most significant threat multiplier to human health in the 21st century. That is an undeniable fact. Climate change is already causing illness, it's causing injury and death across the United States and the world. Those are our friends, our family, our neighbors, our fellow Americans. Air pollution, longer pollution season, longer pollen seasons, and wildfire smoke are making respiratory illnesses worse and cancer risk rise. Diseases spread by tainted food, insects, and water will continue to rise, driven by increasing heat, extreme weather, and floods fueled by climate change. This isn't a future fear, it is a present problem today. But instead of meeting these unprecedented challenges head on by strengthening our public health system and working to combat climate change, the Trump administration is doing the complete and total opposite. It is unscientific, it is unbelievable. Since January, the Trump administration has cut billions in funding for promising medical research, fired climate scientists and public health experts across the federal government, and fanned the flames of medical falsehoods. They continue to do it on a daily basis because the administration has lied about the safety of vaccines, crippled the agencies tasked with protecting the health of the American public. This is absolutely unacceptable. But we have the power to fight back. We must continue to use our voices to call out misinformation when it is wrong, to uplift science and truth, and to support the solutions and the people that protect public health in our nation. They are heroes, and we have to give them the resources that they need. So we must legislate. That is why I introduced a series of bills to address the connection between climate and health, the Green New Deal for Health Act, the Preventing Heat Illness and Deaths Act. We have to move. The Protecting Moms and Babies Against Climate Change Act. We must act. The Asuncion, Valdivia, Health and Heat, Stress, Injury, Illness, and Fatality Protection Act. We must act. The Climate Change Health Promotion and Protection Act. We must act. The Community Mental Wellness and Resistance Act, and a climate health resolution to show that Congress recognizes this threat, and we must respond to that threat. We must continue to fight for a climate resilient public health system responsive to the challenges of the 21st century. Our future depends on it. As my father used to say, don't agonize, organize. So thank you all for organizing this great event. And thank you for the work you do to protect our communities and our world. I'm honored to be working and fighting alongside all of you. Let's get to work. You're doing God's work here on earth to protect all of the creation that has been given to us, and we must pass it on better than we found it.
I'm just reflecting on the amount of work that Senator Markey has been doing. And A, it's quite impressive, but B, it's also depressing, because as was mentioned by Tim, I think he's fighting an uphill battle. And what I kind of want to do is not just be all doom and gloom today. And I'm really hoping that what we hear from the panel is not just the challenges, but really some exemplars, some light of hope somewhere in this moment, that this is not falling on deaf ears. And the fact that you are all here in this very cold, windy, rainy afternoon, somehow it always happens with our symposia, but yet look at this full room. It's amazing to have you here to be able to have this discussion. And so let me start by introducing each of the panelists and have them come up as I do. Our first panelist is Benjamin Sovacool. Professor Sovacool is the director of Boston University's Institute for Global Sustainability. He's a professor in the Department of Earth and Environment, and his work and research focuses on global energy policy and politics, energy security, energy justice, climate change mitigation, and climate change adaptation. Half of those words have been outlawed, by the way, Benjamin. I just want you to know. More specifically, his research focuses on renewable energy, energy efficiency, the politics of large-scale energy infrastructure, and designing public policy to improve energy security. His research has been endorsed by US President Bill Clinton, the Prime Minister of Norway, Gro Harlem Brundtland, the late Nobel laureate Elinor Ostrom, among others. Come on up. I will say he's also the author of the Intergovernmental Panel on Climate Change 6th Assessment Report, published in 2022. We will then have Dr. Marissa Hauptman come up, who is the Chief Medical Advisor at the Bureau of Climate and Environmental Health at the Massachusetts Department of Public Health. What is global is local. Marissa is a board-certified pediatrician, the co-director of the Pediatric Environmental Health Center and the Region 1 New England Pediatric Environmental Health Specialty Unit. She's the associate director of the Boston Children's Hospital's Pediatric and Reproductive Environmental Health Fellowship and an assistant professor of pediatrics at Harvard Medical School. Her research focuses systemically on integrating information about environmental exposures through screening tools, spatial analysis, and biological markers. Thank you, Marissa. Dr. Britta Lassmann is an infectious diseases physician and a health technology innovator. She's one of our own. I take pride in this. She's a CEID Research Associate Professor at the BU School of Medicine, and she's the co-director and co-founder of Beacon, the Biothreats Emergence Analysis and Communications Network, the Outbreak Surveillance Forum that is housed and operated at CEID with partnership with Hariri and Boston Children's. Beacon's an open source global surveillance platform built to detect emerging pathogens in real time. And it merges AI, large language models, and a global network of human subject experts we'll hear a bit more about. Dr. Lassmann's experienced in different disease tracking methodologies, tools, and technologies. She's been tracking a lot of the climate change incidents that we're seeing on Beacon as well, and has cross-cutting scientific areas, research in cross-cutting scientific areas to support informal disease surveillance and risk predictions, including epidemiology, clinical care, mathematical modeling, analytics, and technology. Dr. Lassmann. And last but not least, I won't embarrass Dr. Madad, but I will mention a small fact about her. She's the senior director of the system-wide special pathogens program at NYC Health and Hospitals Health and Safety Lead of Enhanced Investigations Unit of NYC's Test and Trace Corp. She's the director of the Special Pathogens Program, as I mentioned, and her work focuses on preparedness, response, and recovery from infectious diseases outbreak, with an emphasis on healthcare and public health biopreparedness. She maintains readiness for the nation's largest municipal healthcare delivery system for all infectious diseases threats, for ongoing training, education, drills, protocols, and she's the PI of a large CDC-funded project looking at building resilience against climate change within healthcare delivery. So it's now here, it's affecting our health, and it's affecting the way that your clinicians are dealing with your care. She's responded to multiple infectious diseases outbreaks as an epidemiologist for Ebola, measles, and Zika, and she's a fellow at the Harvard Kennedy of Belfer Center for Science and International Affairs. So if she looks familiar, Come on up, Syra. She was also the star of Netflix Pandemic series. That's the reason she looks familiar. So with that, actually, I seated you all wrong. I will move to the other side. Okay. I should have left a seat for myself. I want to start off from right to left because I want to go global to local and in our clinics. So Benjamin, you've worked within both the Institute for Global Sustainability, but before, on climate change issues. Can you give us the broad strokes about the environmental changes that we're headed towards? What's happening in the next 10, 50, 100 years? And what's the latest research show about the level of certainty about these predictions? And what does that mean for us in our everyday lives?
Wow, such a simple question. Thank you. Thank you. Thank you for inviting me. It's a real pleasure to be here. And yeah, I think the future, I'll give you two sides of the coin. I mean, it is bleak, right? The current projections from climate change are quite sobering. There are lots of places to get your data. The US National Climate Assessment used to be where to go, but they've been kind of shut down. So now it's the Intergovernmental Panel on Climate Change, which probably needs a new name. We just call it the IPCC. They do a report every 7 years or so. So we have to wait until 2028 for the next report. But the last report from 2022 did have a prediction. They have all these different scenarios, representative concentration pathways of like 8 of them. But one of the scenarios they ran with high credibility did predict by the end of this century, so by the year 2100, it is as likely as not we will exceed 4 degrees Celsius. And a 4-degree change is very high. Everyone's talking about 1.5 or 2. A 4-degree change might be beyond our ability to adapt to. And that's human systems as well as natural systems. And I'm going to date myself a little bit. I'm a big fan of The Simpsons. Anyone else a fan of The Simpsons cartoon?
That's supposed to age one? Now I feel old.
They did a little meme like a year or two ago that was Bart Simpson, he was complaining it was so hot. Oh, Dad, it's the hottest year ever. It's the hottest year ever because of climate change. And Homer Simpson turns to him and says, no, son, it's the coldest year of your life. To kind of underscore, yes, it is hot, but for children, it will be the hottest year is only in the future as our planet warms. And so I wrote some numbers down, Nahid, because you did talk about these 58% of diseases and 225,000 deaths. That's for disease. Here are just some other numbers from the climate literature. By mid-century, so this is just a little more than 2 decades away, 3.9 billion people will experience aggravated water insecurity. Because of climate change, that will already happen. So this is not future projections. This is if you just account for the emissions we've already done. 3.9 billion will not have water, 7.9 billion people exposed to extreme heat. And for those of you that are wondering, we'll probably only have a global population of around 10 billion. So that's almost 80% of our population will be exposed to extreme heat events, 1.8 billion to food insecurity, 1.4 billion to disruption of livelihoods, and about 700 million to electricity blackouts, which also have health impacts. People who need respirators and hospitals that need reliable electricity supply. And as we already saw with the Texas winter storm in 2022, it tends to be low-income areas and ethnic minorities who suffer the most because they can't get to hospitals or because they can't refrigerate food or medication and so forth. So that's kind of the bleak picture. But to finish my remarks on a positive note, the IPCC does talk about how to accelerate climate action. They call this enabling conditions, and there are many of them: innovation, finance, policy, behavioral change. And I really like that behavioral change one because, while it takes you 7 to 9 years to build a nuclear power plant, you can change your behavior tonight. And in fact, 72% of global carbon emissions are related to our choices as consumers. And there are actually 3 things that you could start doing tonight or tomorrow morning that would cut your carbon footprint more than in half. Stop flying, stop driving your car, and eat less meat. And we can do all of that now. The IPCC also synthesized a bunch of evidence about fast energy transitions and have documented hundreds of fast transitions across Germany, China, the UK, et cetera, that have also affected half the world's population. So if you account for energy transitions across energy supply, energy demand, energy delivery infrastructure, we've had very rapid ones, including in the United States, where we've switched to electric forms of heat and natural gas as opposed to coal stoves and wood. So the record is clear. If we want to, we have all the technology and resources available to fight climate change. All that's lacking is the will.
May have a follow-up question a little bit, but I wanted to switch to Marissa because as Benjamin was talking about these global numbers, numbers tend to wash over you. Maybe we take smaller numbers, we make it regional, we bring it here home to Massachusetts. I wanted to ask you how you're seeing climate change trends impacting infectious diseases, incidence, prevalence, geographic scope. How do you see that changing in the future? And what is the state of Massachusetts thinking about the vulnerabilities and preparedness of this risk? And are there current initiatives that would be of interest to our audience?
Great, thanks so much, and thanks so much for having me. So I heard I wear a few different hats, and before any talk, I sort of think about which hat am I wearing, and the truth is I'm always wearing three primarily. I'm a pediatrician and have dedicated my career to addressing and supporting communities to reduce inequities by environmental mediated diseases. Each week I take care of children with lead poisoning and try to support them in addressing their housing and for environmental triggers of asthma and others. And I come to all my work through an environmental justice lens, and then that lit my eyes about all the climate injustices that we face. I'm honored to have this role at the Massachusetts Department of Public Health, to be in a state where we're leaders in thinking about how the environment impacts health and how we can build climate solutions. So sometimes, and I'm a mother, and so sometimes this quote I turn to when I'm wanting some direction. So it's from the Lancet Countdown in 2019, and every child born today will be affected by climate change. How we respond will determine the world we live in tomorrow and will shape the health of children across the globe at every stage of their lives. I think there are many numbers I think about anchored in pediatrics. A US EPA report showed that Lyme disease with 2 degrees increase in global warming will increase 2,000 Lyme disease cases a year. With 4 degrees, 23,000. Certainly, our Northeast states have been prone to Lyme disease for many years, and that will continue to grow. Thinking about West Nile virus and other arboviruses and the increase in those. I also think about some climate-mediated processes that may not get as much attention, especially maybe the infectious disease intersection around our water quality for our recreation sources of water. The bureau that I'm the chief medical advisor in regulates all our recreational water bodies in Massachusetts, and so the 1,100 water bodies. And in the past 2 years, we've developed a pretty innovative dashboard that anyone can look at the water bodies that they use as a resiliency method for heat. And can see sort of its water quality, and we know that extreme heat increases cyanobacteria and high algae blooms, impacting our ability to really use the water quality. You may have enjoyed the head of the Charles, but that week was very stressful for us at the Department of Health as we tested the water leading up to it to ensure that it was safe for the rowers. And so, I think there's a similar dashboard that our Bureau of Infectious Disease and Laboratory Science puts out around arboviruses to be able to assess your risk of playing soccer with your kids at nighttime and what protections you need. So I can share more sort of prevalence numbers, but I think hopefully that was helpful.
Yeah, as you were talking, I was just thinking there's quite a few beaches I couldn't make it to this summer because they were closed because of water quality. And then it thought about a couple of the reports that we put on Beacon around Vibrio vulfinicus, which is a flesh-eating bacteria. Don't want to scare anybody, but it is kind of a scary bacteria. And we're seeing an increase across the eastern seaboard. In Florida, there were a lot more cases. We're seeing it here It is scary that your everyday activity is so affected, and we don't really talk about how much they're already being affected by climate change. I wanted to focus now, switching to what we're seeing and some of the tools. And one tool, Britta, I know you and I work on is Beacon. Can you speak a little bit about Beacon, how it can be used to study and address climate change-related infectious diseases, and what are we seeing in our first 6 months of, I have the inside scoop because of course I know what we published, but I want to hear what we have seen in the last 6 months of operation that has surprised you.
Yeah, thank you, Nahid. So Beacon is an informal emerging disease surveillance program. It's based at Nahid Center on emerging infectious diseases here at BU, and it operates in collaboration with the Hariri Center, the Computational and Computer Sciences Center here in this building, as well as with HealthMap at Boston Children's Hospital, the computational epidemiology group over there. And so what we are doing, I feel like going back to the opening remarks, is that we are getting a lot of informal signals, media reports, and so on emerging infectious diseases from across the world. But this has been accelerated over like the last decade with more and more of that information coming in. And really, how do we as the human subject matter experts who work in that field, how can we really deal with that amount of information, and how are we able to push that through to the public, to you, to the readers, to governments in a meaningful and timely manner. And so this is where a lot of like the computational power of Beacon comes in, mainly the integration of artificial intelligence and large language modeling. So to give you an example, on like a typical day, we see between 200 and 450 signals on emerging infectious disease events from around the globe that come in through like the pipeline through HealthMap into our system, into the Beacon system, as well as through additional other channels that we use to collect our signals, also from colleagues from around the world who send us personal communications about events that are happening. And then these signals that come in go through like this large language modeling pipeline and AI pipeline and help us to really analyze, to assess severity, to look at media reliability of those signals and urgency, and then create draft reports for us. We currently work with a globally based team of outbreak analysts and subject matter experts who then go in and verify that information, who vet reports, who provide more context on either the geographic occurrence of that event or like the pathogen involved, or if we don't know, like what the pathogen is yet, then, like write more about the differential diagnosis in these specific cases. And so we actually launched, I think it was April.
In this room.
In this room, that's correct. And so we have been operational now for about 6 months, more than 6 months. And so when we look at the data we collected so far, we have received more than, I think, 12,000 signals by now over like those couple of months that we have been sifting through. And we published more than 1,100 reports on emerging infectious diseases, like emerging events globally. And so when we had one of our last editorial meetings, I think 2 weeks ago, we thought like now that we have that amount of data actually and really building up that database, we should really make an effort to try to group that data or like the reports more so that users can actually easily access them and get like information that would be really useful to them. And so there were certain categories that were really easy to define and everyone in the team agreed on, and we had no issue. For example, antimicrobial resistance, very easy to define an event that's caused by like a pathogen, like a resistant pathogen, and we would, like tag it as an event that would fall into that category. Travel-related, like events, we see like infections that are being brought back or carried from one place to another, picked up through one of our travel network partners. That's very easy to tag. But then we really, like wanted to start tagging for climate like sensitive infectious diseases, and that's where like all the discussion started. Where do we start? Where do we end? And then we looked at the reports from, I think, that week, and we realized that actually the majority of the reports we reported that week were somehow, like climate sensitive or climate change related. Vector-borne diseases, like not only what we saw in the United States, like chikungunya in New York, we saw the same, like the highest number of chikungunya cases in France this year, more than 700 by the end of the season now, locally transmitted cases that really triggered, similar like in Italy, high numbers that triggered alerts from the European CDC to really, realize that this will be the new normal for Europe. So really looking at not only the vector-borne, but then also, we are covering Rift Valley fever right now in Senegal and Mauritania. Also climate sensitive, probably something that we will see more in the future as well in those regions. We were covering the leptospirosis, severe leptospirosis cases in the north of Vietnam that were triggered by the flooding from the typhoons in that area. So we are seeing on a daily basis, we are seeing one report after the other that can really be, associated with what we are seeing and reflecting what we are seeing in the changing climate of our planet. And so we really need also the help of the experts to help us, classify that more and really bring it into a format that it can be helpful and useful to the global public health community.
Yeah, and what I find interesting also is that as we get more and more data, trends over time would be incredibly important. We see the most fascinating stories, the ones that Britta shared. There's also Burkholderia pseudomallei, which is a soil-based bacterial infection, pretty severe. It takes months of antibiotics. It can be pretty severe to treat. And there is a case series of basically in southern US, because of increased hurricanes, the soil is getting turned over and the soil-based pathogen is getting more exposed, and people are getting exposed over years with the same pathogens and getting infections. I mentioned the Vibrio vulfinicus. I mean, there are so many stories that we see every day, and it's funny because I was smiling because I went to, when I had, we had this idea of tagging things, and I was like, we should absolutely tag everything for, everything we can find that's climate change, because that's going to change over time. And so Britta puts her coffee cup down and she says, it's all already climate change related. There is no room to grow. There's almost every pathogen we're reporting has some sort of climate sensitivity to it. So I want to bring it a bit closer since we started talking about some of these infectious diseases, Syra. So you look at operational readiness at the healthcare level for climate change. Can you talk about the impact of climate change on care delivery itself, and then what we're seeing and could see in the future? And are there ways to build resilience against this now? And how are you preparing clinicians to do that?
Yeah, excellent question. And before I get started, I'm gonna pick up on the coffee term you've mentioned. So I just want to take a quick poll in the room. How many of you are coffee drinkers? By raise of hands. All right, so I think most of you will probably see the most impact of climate change when it impacts your morning cup of joe. And the reason why I say that is because when you look at some of the reports, by 2050, 50% of the farmland that grows the coffee crop is going to be unsustainable. So I think for the large majority of Americans, even though we're experiencing climate change all around us, they're really going to feel it when it hits their first cup of coffee in the morning, right? But in the healthcare delivery world, we're already seeing it every single day. We're seeing the impact from a patient care perspective, seeing increased levels in emergency department strain because of climate events, heat illnesses, and the like. You're already seeing it from an operational impact perspective, supply chain, and the like, and even infrastructure, right? Flooding, impacting hospitals, evacuations, and the like. So I can kind of go on and on and on. But where I want to focus my, my remarks is what are we doing in terms of addressing climate change and making healthcare more climate friendly and climate ready in that sense, and adapting to this ongoing crisis. And so I'm happy to share that one of the tools that we've recently developed in the past year is called Be a Climate Health Champion. And this is essentially training clinicians to be more aware of the risks of climate health and the impact it's having on patients, and how they can be a trusted source of information and share this information with patients most affected, and then how we can overall kind of improve outcomes, patient outcomes, and the like. And so let me just quickly share a little bit about what that particular training is about. It is basically modeled after our COVID-19 Be a Vaccine Champion training, where we essentially trained individuals, particularly healthcare workers and then the community, on how to talk about the COVID-19 vaccine using communication tools, giving them all the information they need about the COVID-19 vaccine and why it's important to get vaccinated. That was such a huge success for us. We trained thousands and thousands of individuals, healthcare workers, community members about being a vaccine champion, that we realized that, you know what, let's just use the same model and look at another crisis that we're continuing to face. And we realized, obviously, climate change is a huge one. In fact, we're seeing studies that have shown that most healthcare workers, over 60%, have mentioned that they want their workforce or their employer to do more in terms of the impact of climate change and what they can do to help decrease, their carbon footprint. And most healthcare workers have also mentioned that 70% climate change is affecting 70% of their patients. So you're seeing that direct impact just in terms of these numbers. And so we developed this Be a Vaccine Champion training toolkit where we've already trained over 400 healthcare professionals, and over 98% have mentioned that this has helped them in talking to their patients about climate change and their risks and what they can do. So we are seeing the solutions, in real time. And I think one of the biggest, takeaways from this particular toolkit and what we're learning is that healthcare workers often feel as if, they're just observers and they don't necessarily know how they can, contribute to being part of the solution. And so when you're, putting these educational, resources for them and providing this training, it helps them become part of that solution and they're able to have a greater impact. And we're seeing this, as I mentioned, through our patient interactions. And so I'm also happy to share that this particular initiative that we've launched, is now going global, and we're seeing other countries internationally adapt to this toolkit. We actually published it online. It's fully customizable. It's about a 1-hour training with a certificate that individuals are able to get. So we're seeing, some of the really good, improvements and impact of this already. So it's exciting.
Yeah, I think it's so important because there is a similarity between pandemics and the climate change related, impact, right? Because they're both sudden sometimes when there's natural disasters, they're disruptive. And we've seen the impact, at the beginning of COVID. For those of you, there might be some in the audience, healthcare workers or maybe even healthcare administrators, you had to do so much planning for, oh my God, all of a sudden, all these new patients. How do I deal with ventilators? How do I, staff this with people? And that is going to be a growing reality for healthcare workers, right? This idea of growing resilience against surges of unexpected disruptive action beyond just the number of diseases that we'll see increasing. I'm so glad for that perspective, because oftentimes we talk about climate change as this research thing, right? It's happening somewhere else. It is happening now. It is happening in our lives. It's happening in our clinics. It's happening every day, and we're already adapting to it. I want to switch back to global, Benjamin, a little bit. One of the most depressing moments in the last few years, and there has been a bunch, there was a pandemic. I don't know if you know, but my field was a bit busy, but I got to tell you, this made me more depressed than the pandemic, which was a statement from one of the climate change researchers saying, it's already too late, that we can't stop the change. And what you presented today was basically that. It's changing. It's just the level at which it will change. The crisis is now, and next month, COP30, the Climate Change International Conference that brings together governmental partners and researchers, is being held in Brazil. What are some of the initiatives or negotiations that you're watching? What's the international sentiment right now?
So maybe I'll surprise you. It turns out, included in the last IPCC report, we had a section, there's a whole bunch of talk about the NDCs, the nationally determined contributions, and it's the UN Framework Convention on Climate Change. These are all the country plans to abate carbon, and they have some problems. There's an emissions gap and there's an enforcement gap, and so they're kind of not keeping us on track to the Paris Accord target of well below 2 degrees. But the optimistic thing is the report found that actually non-state actors, so subnational actors is the term, so this is cities, corporations, voluntary associations, civil society like WWF, the actions that they're all taking will actually have more emissions reductions, has a higher level of ambition than the entire UN system.
Like the state of Massachusetts.
Exactly. So in a way, we're actually doing more already outside of all of this discussion of the COPs to abate emissions. And I can give you just 2 other examples that aren't IPCC based, because the IPCC is evidence synthesis and it's kind of out of date and so forth. Have you ever heard of Project Drawdown?
No.
So it was set up by Paul Hawken, who was an ecologist, and it's got 100 scientists and I think a few royalty, it's, for prestige. And it looked at like 90 things that we could do to draw down CO2 concentrations by mid-century. And I'm amazed at the top 2 things we can actually do very well and very quickly. The biggest single wedge, and I'll give you just a little bit of numbers, we have to draw down about 1,000 gigatons of carbon. More than 10% of that, so more than 100 gigatons, which is a massive amount of carbon, can be actually achieved with better education of young girls and women. And that's family planning and better training about indoor air pollution and cooking, which is a huge health issue. And then the second one is food waste. So these are things that we can also start doing right immediately and very rapidly. And in fact, my colleague Jinin has a book called Girl Power, which even lays out a way to empower young men and women around the world to have different empowerment muscles that follow people like Greta Thunberg in her example. So I do think that there are more solutions than we think, and the solution may not be nuclear power. To go back to Project Drawdown, that 100 gigatons that you could save from better educating girls and women, you get 2 from nuclear power, 1.8 from wind power, 1.5 from EVs. So let's think about that. Better training and education of girls is 50 times more effective than nuclear power. We can do that.
This panel is not surprised. Thank you for that, Benjamin. Marissa, I want to, taking that bit of hope.
I know.
I will make a statement. You don't have to comment on it. I will say that we've taken a step backwards at the US national level when it comes to climate change. And so states, exemplar states like Massachusetts, that are making a difference, right? How do you keep the momentum going, and what are the challenges that you're facing? What can one state do alone, and what can it do beyond itself?
Thanks. Well, I think that now is the time to be innovative in our solutions and to be bold. And certainly the federal government is a critical entity. I just came back from an NIEHS, a National Institute of Health conference in Kentucky, and all about engaging our community partners and for funded centers across the country. And our federal partners couldn't be there. And they're critical partners in the work we do. However, I think Massachusetts has been a leader in environmental health for many years. We're one of the first states to think about smoke-free housing and to lead the efforts on identifying lead poisoning as a neurodevelopmental toxin, and the list goes on. And I think we are similarly a leader in climate solutions. For the first time, we have a climate chief here in Massachusetts, Melissa Hoffer, and we have a resilient mass action team across the government agencies to think about climate solutions as well as building resiliency. And each agency at the state meet regularly to think about how we coordinate our efforts. In our bureau at the Department of Public Health, we've launched this Heat Education Alert Tool initiative to increase awareness around extreme heat as being the highest climate mortality driver, despite maybe not getting as much press historically, and to come up with real solutions, partner with healthcare partners and local boards of health to raise awareness of things that you can do to both identify heat-related illness and heat stroke, and as well as building adaptability and resiliency for the communities. And so we divide the unhealthy heat threshold across the state of Massachusetts, so all agencies can act on the same max daily temperature of 85 degrees, and we studied it over the last 6 years from our bureau and found that it was associated with heat-related illnesses and ED visits across the state, and really gives sort of an aligned threshold for everyone to act. And we send alerts to community-based organizations so that they can support their communities, as well as through our Health and Homeland Alert Network across the state. Each time a extreme heat event is triggered, we alert them with tools that I love the Be a Climate Champion, because that's what I think something that can really spread here I think you're right that healthcare clinicians want something that they can we want a prescription for climate, right? We want something we can prescribe our patients. And so we're working with Mass Health to figure out how we can prescribe cooling resources. And, we're thinking about other ways that clinicians can give their patients a prescription that is actionable and targetable and helps build resiliency. So that's one example. I'm sure there's many, many others, but I'm thrilled to be in this state.
Yeah, I think there are other states that are doing that as well. And I wonder if there's power to building consortia, right? I'm trying to figure out how you subnational organizations could potentially do this in greater number of consortia. Britta, I want to switch and sort of talking about that preparedness and work that we could do to be more responsive. What are collaborative networks, right? Which is really what Beacon is. It's a wonderful tool and a platform, but it really is a collaborative network of both subject matter experts that we have in 12 countries, but also organizations that are technical partners across all these different spaces, disciplinary spaces. So how do we get collaborative networks like Beacon to play a role in preparing communities and health systems for climate-driven disease threats?
Yeah, sure. And so I think when you think about Beacon, it's like two things. It's on one hand an early warning system. We are pushing out these reports on emerging events that are happening around the world, but it is also a situational awareness tool. And I think this is really where a lot of the situational awareness and potential also guidance for public health officials and clinicians come in. So Beacon, being part of CEID, has a component to add related resources to each report, for example, meaning that if you read a report on chikungunya in France, you would also be guided through related resources in regards to testing, symptoms, clinical symptoms, as well as possible preventive therapeutic measures, which are not that many with chikungunya. And so by pushing that out along with the report, what happens is that the readers, the individual physician readers, the users on the ground who read that, if you see that happening in a neighboring country, in a neighboring, or within your region, it raises your alertness level to really, investigate further. If you see a patient with compatible symptoms, you might be the one to send off this one more test to really try to figure out what is going on. And I always like to quote one of our senior subject matter experts, Marjorie Pollack, who has been working in this space for a really long time, and she always says, if you don't look for it, you won't find it. And I think this is really one of those things, about the situational awareness. We know those vectors are spreading. We know that we are seeing more and more of those diseases in areas where we have not seen them before. We know that seasonalities are shifting, that transmission seasons get longer, they start earlier, they might not be there at all anymore, and we see year-round transmission, for some of the pathogens. So really being alert enough to have that suspicion to send off this one test that would, in that case, make a difference. And definitely, embedding that into a collaborative network. I think for Beacon, we depend a lot on our partners to submit information, to really share information with us, and also for us to reach out to them to verify and validate. And so I think this is one of the areas too where we feel strongly that having an open access program that allows everyone to access the information for free without a paywall barrier, and really enabling that global collaboration will result in best outcomes for everyone.
Yeah, and it's very interesting. I think we've seen a pick up an interest among clinicians, for climate change, but of course, infectious diseases in general on Beacon. And actually, one of the earliest users have been travel medicine physicians trying to assess risks, sending people to places where risk is changing because of climate change. And one of our trusted partners, TravEpinet, is one of the collaborators actually in the audience. Andres, it's good to have you. And we have others such as GeoSentinel, which is a network of returning travelers, clinics where there's submission. And what we're seeing a lot of times are submissions about cases that clinicians are seeing in new areas. A lot of times it's one of some of these vector-borne diseases that are climate-driven. And so we're seeing in real-time submission from clinicians that they're seeing a change in the type of risk they see in everyday practice. So why don't I switch back to clinical work a little bit? And can I have you, Syra, talk about how climate and disease preparedness efforts reduce rather than increase? How do we make them reduce rather than increase health equities, right? And what we, like, I think of AI, amazing tool, but it's a new frontier potentially creating new inequities, right? So how do we ensure, as we think about these climate preparedness efforts, that they are more equitable, and that especially given the burden that majority of the people who carry the climate change burden are vulnerable populations. It's elderly, patients who may not have access to cooling, or a child in Global South where there is no clean water, right? Like, so how do we ensure, at least locally in our communities, that there's greater equity?
Yeah, absolutely. I mean, we know that climate health oftentimes affects the most marginalized in our community, similar to outbreaks and pandemics. And so there's 4 things that I'll briefly highlight. One is, we recently put in a grant application to develop this medically vulnerable index with a couple other collaborators, so that way we're able to get hyper-local when it comes to all different hazards and being able to get to the patients that are most marginalized. And so we did put that application in. We're hopeful we'll get funded, but you never know in this day and age with everything happening. The second is in our climate health champions toolkit, we've built in a lot of these considerations of those that are most marginalized, most at risk. One thing, many don't even realize is those that are incarcerated, right, are in that marginalized and at-risk population. And so we've built in those specific considerations into our climate health champions toolkit that folks can then customize based on their locality. So that was front and center, and we always want to bring that in the beginning and not obviously at the end. And so that was really important. The third is some of the communication tools and resources that we are looking to develop and have put together. One is a recent example. As you know, in New York City, we had a very large Legionnaire's disease outbreak. One of our hospitals was, kind of
another climate change issue we reported on Beacon.
That's right, yeah. And one of our hospitals was really the most impacted, Harlem Hospital.
Can you speak to that a little bit, what that is? Because I think that's an important, appropriate example here.
Yeah, no. So, with Legionnaire's disease, we certainly, it's not a new disease, right? And with this particular disease and with this particular outbreak, we were seeing implications in cooling towers. And so there were a handful of cooling towers that were impacted in New York City. And so for one of our hospitals, it was located at an area where it was the epicenter, where some of these cooling towers were located. So you're seeing a lot of patients come in with pneumonia and flu-like illnesses. A lot of them required hospital-level care. Unfortunately, there were a couple of deaths associated with it. So it was a pretty impactful outbreak. And one of the things that we were able to do from a communication standpoint is send out a message to patients that were most affected in the areas there. So we had about 5 or 6 zip codes where we were seeing the highest number of cases and where the cooling towers were. And so we were able to quickly put together a very quick, message through MyChart, which is what we utilize to share, what's happening, what you should look out for, and how we can connect you with healthcare services, even virtual express care. And that's a great example of how we're able to bring in some of these solutions during these types of epidemics and the like. And so one of the things we're putting together is a climate health communications work group made up of clinicians and emergency preparedness coordinators and communication specialists. So anytime that we're seeing any type of hazard, it could be high heat, it could be flooding or infectious disease related, we're able to send out these messages quickly, craft the message and send it out to patients. And then on the back end, we're also trying to develop a very similar communication mechanism to educate the clinicians. And so using a different type of pathway like Everbridge and Alert Us, putting together very similar templates and content. So that way, when you first log into EMR, maybe you have a message that appears saying, hey, we have a Legionnaire's disease outbreak. These are the screening processes you should be looking at. This is how you can report it. Things like that. Or we're going to see, a high heat day. These are the things that you should be aware of. So that way, those are some of the things that we're developing. And then the last thing that I'll just quickly mention is going on to the third part is we're working with some of our OBGYN leads across the system to do a pilot where, when we have high heat days, we're able to send a message to pregnant persons that are most impacted to say, hey, it's a high heat day. Maybe you should change your appointment virtually, or these are the things you can do to protect yourself, or connect them with cooling towers if they're not already in a place where there's air conditioning. So those are some of the things that we're doing from a communication standpoint. And the fourth thing that I want to just briefly mention, and I want to put a plug in for Beacon because I feel like it's such an amazing resource that situational situational awareness is so important. And so at Health and Hospitals, one of the things that my team often does is we look at outbreaks happening all around the world, and we put together kind of this monthly list that we update near real time of outbreaks that clinicians need to know that if this infectious disease ends up in our emergency department, there's a high risk of person-to-person transmission. So it's not an all-exhaustive list, but it only includes those infectious diseases where we, where we want to isolate the patient, identify and isolate the patient faster. And so we look at sources like Beacon and ProMed and many of these other open source information, along with some closed source information to put this and curate this monthly list that we update near real time. And we recently started adding in information on vector-borne illnesses and other types of diseases that are impacted by climate into this report. So from a situational awareness standpoint, we want to educate and make sure that our clinicians are aware that this is happening. And you mentioned chikungunya in Long Island. There's obviously West Nile. So these are things that are constantly happening around us, and we want to make sure that clinicians are aware and they have the proper information to be able to screen for these diseases and patients and connect them to the resources that they need.
Yeah, it's, Legionnaires has been an interesting, I forgot about that. That is a great example. So as you mentioned, cooling towers, water towers, temperature, climate goes up, more heat days, more people using AC, more water sitting around in heat. Grows pathogens, and actually many of these areas debilitating infrastructure, building infrastructure, older building infrastructure. And so it's not just New York. New York actually, aside from New York, there's Illinois, there's Canada, there's a few that we've seen actually seeing more rates of Legionnaire's disease. But what's interesting is a confluence of another crisis here, because New York's solution to this outbreak was better testing of water towers, more frequent public health visits by public health workers to do testing. So they had to increase just a little bit before this outbreak. I think they had to let people go. They had to hire more people to build up the public health workforce, which is bad for us as we see this climate change crisis come up, because there have been cuts to public health, as you know, and a huge percentage of states are reporting a reduction in public health workers. It's been growing since the pandemic, but it's, with the funding cuts, we're seeing actually more of that. So confluence of crisis as we're seeing changing risks. So let me step back and ask both all of you a couple of questions before we turn to the audience. We have a little bit of time. I want to know, and anybody can answer this, in your mind, what are the biggest gaps in knowledge or research questions related to climate change, and it can be about infectious diseases or not, that you think are critical for our readiness and response? Because I don't want, as I said at the very beginning, this is not supposed to be an academic exercise. I want this to be, this is coming, this is how we prepare, this is what we're doing. So what are our gaps in doing that? Anybody?
Gosh, everyone looks at me. Yes. I'll give you one. So there's a huge spatial bias in a lot of research on climate mitigation and adaptation. I'm guessing possibly for medicine. There's a term called weird countries. Western, educated, industrialized, rich, democratic. Turns out that these weird countries are 13% of the population and 87% of scientific research. So there's a huge push, right, to do research that is in the global south, research that is not in normal democratic industrialized countries. Agrarian countries, authoritarian countries, illiberal societies, and so forth, and societies that are very different than us. And I'll just round this out. Turns out 90% of the global population has never flown on an airplane. So think about the types of elites we are here, just to even have access to that resource, and the types of lives that people live that are totally different than ours. We know very little about, climate action there, or I'm guessing disease preparedness.
I think there's so many gaps in what we know. I think I always say medicine keeps me very humble. And I think about gaps in sort of solution science or implementation science to, thinking more locally here, like are the education campaigns both for patients and healthcare professionals effective? I think one of the gaps that I think about, I think Massachusetts being a leader when in the past administration, 139 organizations across Massachusetts signed on to the White House HHS healthcare climate pledge to cut our emissions in half by 2030 and net zero by 2050, because if healing's at our healthcare's mission, we shouldn't also be contributing to the climate crisis. And I think that's a very tall order to do, to maintain our healing mission and our effectiveness there, but also reduce our impact on our planet. And I think that needs more research to know how to do that and do it well.
And I would push probably like even the step, like before that. I think in order to do like the proper research and answer those questions, we need good data sets. And I think what we are seeing with climate change and infectious diseases, we need global data sets. We don't need regional, country level. We need good data sets that are interoperable on like a global level to really understand those changing trends, those changing dynamics, and also the spread of potential, like vectors and diseases across borders. And yes, there's probably need also for more granular data on like a national level or country or regional level to really then inform the public health interventions. But to really understand the bigger picture, I think there needs to be a push for better global data, not only climate change, but also environmental data that would really help us start answering some of those questions and fill those gaps.
Yeah. There's a couple of things that I'll mention, and I think first, definitely, data is king, right? And I think we live in a world where we live in a time where everything is becoming super polarized, and climate change is one of them, unfortunately. There's a lot of climate change deniers out there, and I think when we look at the amount of data we have, it's very little, and so we certainly need a lot more data to kind of show the impact. We know the impact is there, but I think we do a shitty job, honestly, in terms of like showing that and collecting the data. So I think we really need to do a better job with having more studies and collecting this data so that we can show that this is the impact is real. Like, for example, in New York City, we had several days of poor air quality because of the Canadian wildfires, and I haven't seen many studies that have shown some of the impact even from a clinical standpoint, and we know that it's there. So we really need to do a better job of collecting this data and publishing it and showing the impact. Second is I wish we would invest more in surveillance, putting my EPI hat on, not just for infectious diseases, but for these environmental hazards as well. We really need to increase our surveillance efforts, but it's happening at a time where there's so much cuts to funding all around, and we need to scale it up. Instead, we're scaling it all down. So I would love to see more surveillance happening. And third is we need to do a better job educating the public, not just clinicians, right? Clinicians play such an important role, and helping obviously train them in terms of the role that they play as trusted messengers and giving them this information of how they can talk about climate health and the risks to their patients and connecting them with solutions, but also to the general public of what impact it's having on them and their daily lives. And so we need to do a much better job of educating them about what's happening around them. So those would be my 3 wish lists. There's so much more, but I'll stick to those 3 for now.
Yeah, and maybe one more question, and I'll keep it brief, because I'd love to hear questions that you guys have in the audience, and also your experience, right? I mean, what are you seeing in terms of climate change in your everyday life? So it seems to me when it comes to climate change, and particularly on infectious diseases, we have limited resources. And where do we focus those resources and attention in the next 2 to 5 years, immediately, right now, right? Like I think we're planning about the long-term changes in behavior, but like in the next 2 to 5 years, what can we do now so that our longer-term trajectory is better in terms of mitigation? Do we do adaptation? Do we do preparedness? Do we do a combination of all of those? So just some thoughts from your lens in the world.
I can start. At least from our Department of Health, there's sort of 4 pillars that I think about. And each of them are centered in equity. I think it's engagement of the community and really sort of hearing, what the needs are for different communities and how to meet those needs. It's modernizing our data infrastructure, our technical capacity to respond, I think, and then it's centering this work in equity, as well as really thinking about our response and how do we respond and build resiliency, and the 4th is mitigate, like working with healthcare institutions to mitigate their carbon footprint, investing in clean energy and doing what we can
Yeah.
with the tools we have.
And I think for the audience, I think mitigation is what we do to reduce the risk. Adaptation is what we change so that we're more resilient. Preparedness is what we do to potentially create greater resilience in the future. Other thoughts on that?
Yeah.
So-
Yeah, go ahead, please.
So from our perspective, our work with Beacon is more in the preparedness, like surveillance space. I think, like all the areas are probably equally important, but from our standpoint, we are really trying to also understand our data blind spots. We know that we get less data from some regions in the world where we get less signals, where we get less media information, and to really try to mitigate that, to make sure we get that information. We then try to actually place human subject matter experts in those regions, in those countries where we know that we have a problem getting information from, to see if we can, like somehow work and improve those data blind spots. I think, again, going back to the open access model, I think, like really making information, making data, making research results available, open access to anyone who wants to access that is another big piece of that equity piece, to make sure that the access to those data is there.
Yeah, and I think to answer your question, I think first it should be all of the above. It's adoption, mitigation, prevention.
That's always the right answer, but do we have enough resources for that?
But then I think we would need to look at it really from a near-term and a long-term perspective, right? Like, yes, the right answer is it's all of the above, but can you do all of the above right away, right? So you need to really triage and see what's priority. And I would say, near term, we need to look at adaptation and mitigation, and certainly long term, we need to continue to look at prevention and preparedness and the like. So it's really all of the above. But in terms of the near term, when it comes to adaptation, for healthcare, we need to make sure our buildings and our infrastructure can withhold these climate change events and all hazards. And we have an amazing team at Health and Hospitals that does a lot on the ops side that I can't even speak of, but like really looking at this from the infrastructure perspective, I think is so important. But I do want to, I think, focus on, a little bit is some of the work that we could do in terms of mitigation right now. And so I was part of our Quality Academy a couple of years ago, and I worked with a colleague who's an amazing infection preventionist. Her name is Britta, and we worked on a project together looking at PPE usage across our healthcare. And as you know, obviously there's a huge usage of PPE in healthcare in general, right? And we looked at, how can we reduce the amount of PPE that we're using every single day? These are one-time disposable items, and there's tons and tons of it that's generated every single day. And so we focused on surgical and isolation gowns. And one of the things that Britta was able to find through looking at her hospital and me working with her, was that there was a very high usage of surgical gowns at one of our facilities. And we wanted to dig deeper of, why are we seeing so much more usage of surgical gowns versus isolation gowns? And just for context to the audience, surgical gowns are more expensive, the thicker material, sterile, and they also have a larger carbon footprint. And so between surgical gowns and isolation gowns has just generally a lower carbon footprint, if you will. But they're also, the use cases are different, right? But what we were seeing is that this one facility had a very high level of surgical gown usage and a low level of isolation gowns. So to us, in the beginning, we realized, well, there's probably an issue of when they should be using it. What's the most important time to use it, depending on the type of case you're dealing with. And what we found was really interesting is that there was a huge behavioral element to this. People preferred the surgical gown because it was cold in the hospital and that the material was thicker. And so they preferred wearing the surgical gown over the isolation gown, even though it was more appropriate of wearing the isolation gown in that particular clinical context. And so our strategy was, well, this is behavioral focused, so let's educate the workforce of why it's important to go with a surgical gown versus an isolation gown and vice versa. What are the use cases there and why it's important for us to choose the appropriate gown and how that's helping lower our carbon footprint in that sense. And so there were signages created, some education created around it, like videos that she was able to put together, and it did show an impact over time. And so those are some of the solutions that we're bringing on from a mitigation standpoint. I have one of my team members, we have a very robust climate health fellowship program, and so one of our climate health fellows is basically looking at all the different PPE that we're using across the system and targeting those that are most used and how we can reduce the amount by looking at behavioral impacts. You see, like, sometimes healthcare workers wearing gloves and pressing elevator buttons, right? Like, do you need to wear a glove for that? And things like that. So really educating them from a behavioral standpoint. So those are the solutions that we can do from a mitigation standpoint.
Yeah, I love that. I love that example. I love micro examples because in my world as a clinician, maybe that taints my perspective a little bit. Reality exists in the details, right? As an infectious diseases doctor, I often get called to cases going, can you figure this out? And it's probably because somebody didn't read everything in the chart, because the reality exists in the very micro level a lot of times. And I think hearing those stories really exemplifies that. So we have some roving microphones, right? Yep, I'm seeing Una here, and we have some questions. So why don't we take a question here?
Bill Gates, for the longest time, he said the climate crisis was the #1 threat to humanity. This week, he published an essay, and if I understand it correctly, it is not #1 anymore, disease prevention and hunger. Why, can you comment on why you may think he switched his thought process?
Also, Tony Blair published a piece also 6 or 7 months ago that said that the solution to the climate crisis was not mitigation or adaptation, but it was things like vertical farms and direct air capture and carbon storage and all of that. So yeah, there are these kind of tech solution people that do kind of view the architecture for what we can do very differently. Bill Gates is also a big fan of nuclear power as well, which has huge risks to future generations, in my opinion, and the risks of Fukushima accidents and so forth. The problem is there's even our challenges like climate change and diseases and equity and poverty are now interconnected. And you have different terms. I don't like this term. People have called it the poly crisis. If you've seen this term, I'm kind of like, I don't know.
Confluence of crisis.
Yeah. Another term is wicked problems, which are highly complex problems that interconnect and that defy our solution space. And I think there's nothing wrong with saying that diseases really matter. And does it really matter if climate change is first, disease second, disease is first, climate change second, as long as we're acting? But I'm hoping that maybe he changed just because he realized that interconnectedness really mattered, and maybe there were some near-term interventions in the health space that he thought would have greater immediate impact than in the climate space. Climate actions take generations to pay off. That's the other challenge. A ton of CO2 stays up there for up to 10,000 years, and so actions now will benefit generations, but they're not really going to benefit anyone tomorrow because CO2 lasts so long.
Yeah, I think I had a similar thought process in terms of, I think sometimes, I think one of the best ways as an environmental medicine physician or in my role at the state is to not create a workforce of environmental medicine physicians, but really integrating climate and the environment into different healthcare fields. And I think similarly, nutrition is going to be impacted by climate crisis. It already is in terms of the nutritional value of our food and or hunger, I guess, as well as asthma and heart disease and sickle cell disease are all exacerbated by worse air quality or extreme heat. And so, I think you can say two things can be true, and our solution can be beneficial to both, I guess.
Yeah, I'm curious, why do you think that? Why do you think he changed it? Because you asked the question because you may have had an opinion.
He's being pressured by the Trump administration. Again, I'm just throwing that out there. I have no idea.
Great.
But it's very interesting why all of a sudden he switched this week.
Other questions? We have one up here and then one there. Why don't we do here and then there?
Thank you for this great discussion. We are planning to go to medical school, so I was wondering if you have any advice for clinicians in training to be prepared for a rapidly changing landscape in terms of infectious disease and climate change. And also, what do you see the role of medical schools? How can medical schools help prepare future clinicians for this?
Yeah, can I take a stab at that? Okay. I don't think I had any lectures on climate change when I went to medical school. And in the grand scheme of things, in the eons of climate change, it wasn't that long ago that I went to medical school, right? And there are two things that I would say. I think that just as we have adapted, for example, to the opioid crisis, I think it plays a bigger role now, right, in medical education. When you go, you'll see it's just a big part of delivering care. It has to be part of our educating clinicians in terms of both how they approach diseases, how they think of it as an independent risk factor potentially for their patients. I think once you're practicing, it's two things that I think clinicians need to think about. One is the disruptive nature, which is what I mentioned, the readiness to potentially have disease events that are disruptive and what that means as a clinician to triage and take care of these types of patients. Heat strokes, other things. And you might have heard the term horses and zebras, right? Like, go for the obvious diseases, don't go for the zebras. I would say as climate change happens and we start seeing diseases where you're not expecting it, keep your mind open to the zebras, because you will start seeing diseases that you do not expect, that your medical school, even now when they teach you, 10 years from now, the diseases that you face may be completely unexpected. I would imagine, for example, the clinician in Long Island may not have had chikungunya at the top of their list. Thank God they ordered the test, right? And it was positive. It was not a returning traveler. There was no reason for them to think that this person may have gotten chikungunya in New York, but they did. But those are two. I don't know if you guys have other thoughts.
I'll just put a plug in for our Climate Health Champions training. I think that's exactly why we built it, is so we can have clinicians part of the solution and they feel empowered. And so kind of scaling that up, I think, is really important. And we've had such a high success rate. So I think that's a great example of how we can have clinicians, again, not just at the bedside, but also talking about the impact of climate health on their patient populations and what they can do to support their needs.
Over there, and then one in the back.
Excellent discussion. I have a communications question. So how do you take the message that you are giving to all of us, because to some extent you're preaching to the choir, and then spread it? And the related question is, how do you activate financial interests that may be on sort of the side of now hurting from climate change, the insurance industry or other interests that could potentially counterbalance interests that, financial interests that is to their advantage to downplay climate change?
Yeah, before you guys answer, I will say I don't think all financial interests are unaware of the risk of climate. The insurance companies, the insurance industry is definitely aware that climate change is here, because I think it was, the fourth year in a row that we've had like 20 billion, is it fourth or second year in a row that we've seen 20 billion in losses from natural disasters here in the US and what's had to be paid out by insurance, right? You guys, I see David shaking his head, so that might be right. But so I think there are industry components to see it, but I'd love to hear what you guys think of that question. How do we solve this comms thing?
Well, it's a tricky question, Yanis, because behind it is this kind of notion that there may be incumbent actors who are like contaminating our communication channels, of which there are, right? There's misinformation, there's disinformation, and so forth. And some of that is very manufactured. And there are trillions of dollars at stake, right? I mean, the externalities from climate change alone, we've projected 30 to 60 trillion a year. And that's even with conservative estimations to the value of a human life, which I think should be infinite, but I guess you can't do that for these econometric calculations. And so there, I think it's very hard. And I think holding companies accountable, we all have multiple roles as not just consumers, as voters, as people who have pensions, as potential investors, as maybe people who sit on corporate boards. And I will just give one example of, I think, real, true leadership in the corporate world is the company Patagonia, where the CEO and the board dissolved the company and gave it back to the earth. So now every time you buy Patagonia clothing, any revenues go to nature conservation. And the board did that. They gave up all of their wealth to help do that. That is a leadership moment. 4 or 5 years ago they did it. And the CEO said he was expecting others to follow, and no one has.
I'm going to switch to just taking that last question because we just have a couple of minutes. I think there's one in the back, Andres. And then we'll switch to the keynote, but we'll hold off. Unless this is a short answer, then we'll see if we can get one more. Yeah.
Sure, thank you. Actually, the gentleman before kind of alluded to the point of communication, the issue of communication. Actually, that was my question in general, but since you talk about behavioral change and education and communication. What do you think are the most effective channels today with all the changes that have been happening in the kind of communicational landscape in the last 5-10 years? What are the best channels to convey the urgency of climate change, right? Yeah, that's kind of my question to all of you.
Yeah. Well, I mean, I think speaking from a communication standpoint for healthcare, we have different tools that we can communicate staff with, but in terms of urgency, unless there's a threat that's happening right now, like you're having, flooding or, another hazardous event, we're able to essentially use tools where you can inform staff in more real time, like you can get a text message through Everbridge or an email or a phone call. So those are ways that if there's an urgent message, we can get to staff and let them know about this hazard earlier on. Those are some of our trigger points, right? The hazard has to be here. The impact is kind of, almost coming in that sense, but I don't foresee those types of tools being used for, things that are maybe 2-3 weeks in advance. And so that's kind of giving an example. I mean, the last thing that I'll just very quickly mention is, and you alluded to this, we used to get this CDC grant from our communication standpoint to help with health resiliency, and this was just across the board for infectious diseases and the like, and that funding unfortunately has disappeared, and it was focused on communication. So we need to make sure we're investing more in these particular types of projects and work, so that way we can see better communication and more data to show what are the best ways to communicate with staff, to patients, and the like, so that we can build some of those solutions.
Yeah, we can take maybe one last question quickly, and then I want to switch to our keynote. Yep.
Thank you. I can be brief. Thinking about data safety and thinking about the groups of people that are not represented in the data sets, especially in societies where it's very risky, it's potentially life-threatening to publish, for example, environmental data. What's the role of the subnational entity, universities, other actors, in ensuring the safety of the people producing the data, or somehow giving them cover to fill those gaps when there are real threats from various actors?
Well, it's interesting you should mention that. I wasn't going to say it out aloud in public audience, but when I heard Senator Markey's remark, I went, oof, is that too political for this moment? And then I listened to what he said, and I was like, everything he said is exactly right? Everything he said is exactly true. And why did I have that moment of anxiety in this moment where I said, oh, it's too political? Because all of what was said was completely accurate. So this idea of even when you mention the truth, the data, not the truth, the data, that there is the risk. So how do you do that?
And so I think I can give you one example here, like again, through like our program Beacon, we recognize that, like communicating sensitive information, and we are seeing it not only, like more from like the emerging infectious diseases angle, might carry, might not be possible for some people. So we offer actually through our platform, we offer that you can contact us. We offer different ways on anonymizing or communicating what you share with us through Beacon to the broader global public health community. So we go as far as saying we can just, we publish what you send us as long as we can verify it in like some ways. And we're just withholding your name, but we can also paraphrase the information that you sent us. So for example, if a government official would send information in, and you would be able to recognize from the way this is written or like the information it contains that is likely coming from a government official in a certain country, then we paraphrase it in a way so that this is not recognizable. So I think there are mechanisms out there, like where potentially not the local university or the local, like entity can protect you, but there are channels and mechanisms out there where you would still be able to potentially get your information out and would be able to communicate with the broader global public health community without risking your job, your position, your...
Yeah, and I think that problem also applies to whistleblowers, I'm guessing, right? So not just research data, but data about potential events that are within certain industries that may be affecting it. Have any thoughts about whistleblowers or what was just asked?
Just to say that all of us on this stage are actually trained in research ethics, and all independent scientists at universities have an independent institutional review board to make sure that we're protecting data, to make sure there's no harm, and the level of red tape we have to go through, which is meaningful, is significant. So I think we're not a Google or an Amazon where we're selling your data. We're never selling that data. It's always anonymized, it's always confidential, and there are so many layers of protection. Usually the criticism is we're not moving fast enough, rather than there's like data privacy issues. Other than the occasional bad apple or the occasional incident of hacking, I would trust my data, and I do with BU, more than I would trust it with a tech company or even a government.
Got it. Yeah, and maybe your question was more on the research privacy, so I didn't get that. But with that, can we give a big hand of applause to the panel? Thank you, guys. The stairs are on this side. And as I make my way up to the podium, and I want to sort of just make an announcement for those who may have just been joining us online and also in the room. As I mentioned at the beginning of the day, Senator Markey had to have a change in plans due to just his schedule changing and some events that are going on in our government. But not to be undone, we have just an incredible keynote address to help us close out today. So let me introduce Dr. Adil Najam. Dean Adil Najam was the inaugural Dean Emeritus at the Pardee School of Global Studies at BU and a Professor of International Relations of Earth and Environment. He's also served as the founding Dean of Pardee School and was awarded the Dean Emeritus status by BU in 2022. He's still a professor at Pardee School. Since then, he's served as the president of WWF International, one of the world's oldest, largest, and most respected environmental and conservation organizations. He served as a vice chancellor of Lahore University Management Sciences, the director of Boston University's Pardee Center for Study of Longer Range Future, and he has taught at MIT, Fletcher School, and Tufts. He's been the co-author of third and fourth assessments of Intergovernmental Panel on Climate Change, the IPCC, which we talked about earlier today, at work for which the scientific panel was awarded the 2007 Nobel Peace Prize for advancing public understanding of climate change science. In 2008, he was invited by UN General Secretary to serve on the UN Committee for Development. He was a member of the President of Pakistan's Special Task Force on Human Development, served on Pakistan's Presidential Commission on Higher Education, and he was appointed the Prime Minister of Pakistan's Advisory Council on Foreign Affairs. And I have to say this because it's going to allow me to really show off my Urdu pronunciation. The government of Pakistan has conferred on him 2 of the highest civil awards for his global contributions to education and to climate change and research. In 2010, the Sitara-e-Imtiyaz, the Star of Excellence, and in 2023, the Hilal-e-Imtiyaz, the Crescent of Excellence, both awarded by the President of Pakistan. He has written over 100 scholarly papers, chapters, and frequently is cited in academic literature and media and policy studies. And personally, a long time ago, he served as my mentor for a master's thesis, and even then, global security and intersection between pandemics and governance. So with a warm welcome, Dean Adil Najam.
Thank you, Nahi. Thank you very much for embarrassing me with that introduction, except for the last part, which I cherish. But as you can now all see, my greatest talent in life is writing my own CV. So it is wonderful to be here. I think I'm good.
Yeah, just on the audio.
Good. Okay, it is, let's see if, yes, that's how we want to see the world. It is a great pleasure to be here, and thank you very much, Nahid, for having me, and thank you everyone for being here. And thank you to all the wonderful panelists and the discussion before. Please join me again in thanking them, because this was really a very rich discussion in many ways. They have already said a lot of what I would have wanted to say. I will just plagiarize from them and say it again. So my name is Adil Najam, and I've worked on climate and development. I come to climate from a development side, but I've now been a climate person for longer than I ever intended to be. And that really is the theme of what I'm saying. I started, I've been going to these climate COPs that you hear about now since COP-2. No, there really was COP-2. It just wasn't called that. We only started calling them COPs later, but I was at COP-2, I was at COP-0, I was COP-1, COP-0. And I never thought I would still be talking about this in 2025, right? Maybe we were naive, but the sense was, okay, we are a decent enough species, we will lick the problem, and then we'll move to something else. Right? And that's the theme of the story. And I don't say that in a facetious way, because the problem kept growing, not just in size, but in our understanding. Right? Our understanding was a much simpler one. Our sense of what it will take was a much more naive one. And things have happened. Things have happened that have we sometimes don't give ourselves enough credit. You'll hear a lot of negative from me also. You'll hear a lot about 1.5 and 2. But a lot of colleagues, and Benjamin knows this better than myself, are also now pointing out, well, you also have to imagine what might have happened if we had done nothing. Right? So I do push back on some of my younger students and friends who think like nothing was done. We would probably be at about 2.35, as I think is where the consensus is landing right now. Right? So it's not as if nothing happened. It's like, it's much more that what we could have done, we did not do. As much as we could have done, as much as we should have done. But anyhow, let me move on. And you already heard the introduction, the many things, so I won't repeat that. But I do want to put this up in case you were wondering in that introduction, why the hell would they make this guy the president of WWF? The best explanation I've heard is because I look like a panda. But more than that, I put that up as my standard disclaimer that I speak to you today as Nahid's friend and a Boston University colleague, not as WWF. I don't think I'm going to say anything that they would disagree with. But if I was talking in that capacity, I'll be asking you for $25 most of the night. So I want to be, this is too important an issue. I've spoken to the panda. The panda is cool with what I'm going to say. I'm going to raise 3 questions. I promise not to answer any of them. They are important questions, and therefore they are not worth answering, but they are worth thinking about. And the first of those questions is, what is the climate telling us, right? I love this room, and I hate the fact that we have to, except the speaker, no one gets to see the beautiful window, right? But for most of this evening, climate has been telling us something outside that window. Right? So I'm not going to tell you what the IPCC is saying. I don't want to tell you what the science is saying. I don't want to tell you what the politicians are saying. I want you to think about what the climate is telling us, right? Which is not to say that the other is not important. But at this point, the climate is telling us something. Here is the stark reality. There is not a person in this room. There is not a person in this room who has not personally experienced climate change. That's what's different between 1992 when I was at Rio and now. We thought climate change was a future issue. We thought the challenge was to keep it from happening. That is no longer the challenge for young people. Congratulations. You have seen what we had never seen. The reality of climate change, right? That is what I want to talk about first, or have us think about, right? What is the climate telling us? Because unless we understand that, we won't understand what the science is telling us, and we won't understand what the policy is asking us to do, because that's the major change that's happened in my lifetime, right? For most of my lifetime, climate was a future issue. It is no longer a future issue. It is still no longer only a future issue. Now the question is how much of a future issue it will be, and so on and so forth. The second, what does it mean to live in what I've been calling the age of adaptation? For the last 15 years, I've been pandering this idea that we were in the age of adaptation. In the beginning, my friends would kind of laugh at me. Then they would say, please stop saying it because people will not focus on mitigation. And now everyone kind of accepts it, unfortunately. That's a terrible feeling. But what does it mean to be in the age of adaptation? If you allow me only one professorial moment, Naheed had already done that. 3 terms to know about: mitigation, adaptation, loss, and damage. There are many, many other terms. Again, Benjamin and friends are much better experts at this. But mitigation is what you do to keep a problem from happening. Right? So most of what you hear when you hear about climate change is really mitigation. That's why everyone talks about energy. Right? How do you keep the problem from happening? Reduce emissions. If you reduce emissions, you're really talking energy policy. Right? There are other things too, but that's why everyone is carbon obsessed. For 30 years, my life's work has been training carbon managers. Right? Adaptation is the failure of mitigation. If you can't mitigate, what happens is you have to adapt. Right? It is not the opposite of mitigation. This is important. It is not the opposite of mitigation, it is the failure of mitigation. So the more you have to adapt, the less you mitigate, the more you'll have to adapt. So in the age of adaptation, it's not that you don't mitigate. You just have to eat gum and walk at the same time. So adaptation, the cool thing is, we are really good at it. We are so good at it as a species. That's why we are in this room. Right? That's what makes us special. It's cold, we invent a sweater. Adaptation. It rains, we find an umbrella. Adaptation. The problem is adaptation always has a cost. And the problem, the crux of the political problem is, the mitigation problem is caused by a different person, and the adaptation cost is coming to a different person. The rain, it raineth every day on rich and poor fella, but more upon the poor because the rich has his umbrella. Right? That's the crux of the climate problem. And now we are seeing what is called loss and damage. Loss and damage is the failure of adaptation. If you don't adapt, what you get is loss and damage because you don't have an umbrella and you drench. And now you'll get pneumonia and loss and damage. Right? This is a central policy point because the 3 types of policies are totally different. Mitigation policy has been cool because mitigation policy, a lot of it is innovation policy. Adaptation policy, I've been arguing, is essentially development policy or can be development policy. Loss and damage, unfortunately, can only be relief policy. It is disaster policy. Anyhow, I've gone too much into that. I shouldn't have. Let me come back. The third question that I want to raise for us is, how does climate change how we think about disease and vice versa? Actually, I should cross out the word disease, choose a word and put it there. Fine, give me a word. No? Food, politics, yes, okay. How does climate change how we think about politics and vice versa? That would be a cool question too. How does climate change how we think about food? Last month I was in Stockholm for the release of the Lancet Commission's report on a healthy planet diet. Kind of used the same slide, just called it food, right? So, but this is really the point I want to leave us with today. That climate change is changing climate change thinking itself. That the worst thing we can do is to keep thinking about it as we were 10 years ago. That's not the worst thing, but that's not a good thing. It's not the worst. I have a proposition, and the proposition that I come to you with today is essentially has these 3 parts. Now, that's way too many words to have on a screen, so let me make it easier for you. 3 parts. The first is that the age of adaptation changes how we think about climate change. Right? I'm actually not going to spend too much time on that, but it changes the politics, it changes the policy, it changes the options. That is why in my other work, it is very clear that the politics and policy of climate change is about to become much more dirty. And it's not got to do with who's in Washington. That was already happening. It's going to become more contentious because its climate becomes more personal. Therefore, I may feel for the people who are suffering in another part of the world, but right now I have to save my own. Right? This whole thing about local starts looking not very good. It starts looking selfish. We've seen that with COVID, by the way. Right? Local essentially can also translate into selfish, me first. So anyhow, that's one part of the proposition. Proposition part 2, climate is fundamentally a human issue. That is why disease is important. Much before it's a carbon issue, it is a human issue. And finally, this is the only reason I'm here. No, the only reason I'm here is Nahid, but the other reason I'm here is climate, and I wish Benjamin was here, please convey it to him when he comes back. Climate is way too important to leave to the climate people alone. This is really, for the last many years, at least my life's work. It is way too important. Climate people do not have the ability, they do not have the wherewithal, they do not have the money, they do not have the science to deal with it alone. So on behalf of all the climate people in the world, I come to you, asking for help. Right? And I've been doing the same. Last week, I was doing it with faith leaders with exactly the same point. This is too big an issue to be left only to one community of carbon counters. Right? And I'm not saying that in a facetious way, I'm saying that as a card-carrying member of that community. Having said that, and my apologies for just going on these tangents, very quickly, life after Paris. People know what I mean by Paris in this case. Many of you might have celebrated it, or you thought it was a good thing. Many of us, I was there. It wasn't pleasant, and well, Paris was, but the meeting wasn't. We all knew we were lying to ourselves. But essentially, if you think about Paris as the framework for climate policy and where we are, it gave us these two numbers, right? And both were lies. We knew that. We knew, all of us knew that right there. But they were good lies, right? They were the type of lies you want to tell yourself, like I will lose weight, that sort of lie. And one of those lies was, well, one of those numbers was this number. I used to put it, I see at least one person who was in my class, and when I used to put this in the beginning, I would ask, what number is this? And people would count the zeros. What number is this? That's 100 billion, right? And in Paris, that seemed like a really big number. In Paris, 100 billion seemed like a big number. So the politicians are cool, right? They know that if you're really going to lie with a number so big that while they're saying, wow, right, they don't realize that this is not going to happen. But that's not why I'm putting it up. Why I'm putting it up because it sounds like such a small number, right? Benjamin and friends are already dreaming in the trillions. Right? The climate people are so good at inventing big numbers and then talking about it as if they are real. But the 100 billion number, this is why I mentioned your pandemic, right? How much was spent? 6.5 trillion. The US Congress invented $1 trillion out of thin air. It took them 5 days of talking in the Congress to invent $1 trillion. It took 4 to spend it. 4 days later, they were all sent in those checks. Right? By the time it ended, 3.2 trillion was added into the money, just printed. The reason I say that, I've learned now very well, when someone says there is not money for your issue, they're not saying there isn't money, they're just saying they don't want to give it to you. So money is not really the problem, and this monopoly money that the cops play with is part of the issue, but it's not the only issue. Right? There is plenty of money when we actually want to spend it, when we actually think something is real. The other number is more important. You've already heard it today and otherwise, which is this number 1.5 to 2. No one wanted 1.5 really. They came thinking we'll say 2 will be the limit, and then the small vulnerable countries, the V20 and others, small sort of coastal countries and island countries said, look here, by the time it's 2 degrees, we are already kind of down, right? So this movement came for 1.5. So if you read the text very carefully, they snuck this in as if they didn't mean it. We will try for 1.5. At this point, Benjamin may agree, I know of no science known to humans. I've been putting that cross on that now for 10 years. In the beginning, people would complain. Now no one even does that. There is no science known to humans that can keep us below 1.5. The best we can do is we can overshoot and then sort of bring it back. By the way, there is good news. This was supposed to be the years that we reached peak emissions. We are not probably going to do, but by around 2030 we will. And please write a thank you card to China. It's nearly entirely China. Even in the other countries, it's their solar panels. But we will reach peak emissions, but that doesn't get you there because there's a lot of other things happening in the system, right? But there is no way, no how 1.5 is happening. Why am I doing this? Not to depress you and not to keep you from what is smelling good, but to essentially say climate is not a future issue. That's what I'm going to try to prove, not prove, to remind you. And the reason I'm going to do that, the way I'm going to do that is a whole number of years, at least again, one person can testify. About 10 years ago, I decided I will try never, not always, but I will try not to use graphs that are in the future. I would have refused to answer Nahid's first question. Because we climate people love talking about 2070, 2100, 2045, 2122, you know, Al Gore gets on his staircase and goes up and all that. Right? And I loved that too. Until I realized that the message I was giving to young people was as if we have time. Right? They were seeing these graphs and thinking, okay, that means we have that much time to do something. And that is no longer true. So for the whole bunch of years now, I insist on using data that is in the past, or at least when I can. Because at this point, I can make my case that way. I don't need the data about what will happen. So anyone remember 2020? What happened in 2020? What? It was small, yes. I'll talk about the other one. President Brown was here. I wish he was, because he like me, even more than me, was writing a lot of memos that started with, this is a year like no other. Thank you for doing what you are doing. You are all working so hard. We really weren't, but that's what we said. So two great pandemics hit the world in 2020. One of them was yours. What was the other great pandemic that hit the world in 2020 that hasn't gone away? Sorry? Climate, 2020. Anyone? One was COVID and the other was Zoom. Zoom is much worse. It stays with us. It gives you nothing except the ability to put cool pictures behind you when you are teaching a class over Zoom. That's me teaching my sustainable development class right after COVID. But that's not why I put it. The reason I put it is the following. Let us recall what else we were doing in 2020, right? So we can all remember 2020. You can't say this is 2070. You can't say this is before I was born. So I've purposely chosen a year that you can remember, and let me tell you what you were tweeting. I bet you there are people in this room who were tweeting some of this, and then they stopped. Then they went back to the dancing cat. January of 2020, hottest January ever recorded since we had been recording global temperature. February 2020, second hottest February ever recorded since we had been. Remember, people were tweeting this. You're all getting worried as if you were getting ready to do something about it. You never did, but nor did I. March, second hottest March ever recorded. April, second hottest April ever recorded since we'd been recorded temperature. You see the pattern. May hottest, June hottest, July second hottest ever, August second hottest ever, September hottest September ever. Right? By this time, we were all back to the dancing cats and the Amazon trucks that were bringing all that stuff for us. Right? October, third hottest October ever. November, hottest November ever. December, you get a little respite. It's the 8th hottest. What is special about this graph? What is special about, not this graph, but this picture? Each one of those numbers is no longer true. Breathe that in. This is not very far off. Each one of those monthly numbers is no longer true. Hence, QED, climate is not a future issue, right? Again, that's the point I'm making, but I'm going to, you don't need labs on this. I was literally in a train when this hit me. This is a tweet that I did, and those pictures, essentially, I got from just clicking on my iPhone. It just hit me on that day. This is the 29th of April, 2022, and I tweeted that nearly 1 billion people that day across only my region, South Asia, where I come from, are seeing temperatures of over 100 degrees Fahrenheit, in some cases more than 170, right? I'm a South Asian, I'm a Pakistani, I'm used to heat, that's fine. But not for 1 billion people and not in April. Right? So you don't even need to go deep into the data. Climate is telling you something right outside that window. I'll just tell you the story of the presentations I had given. I was giving this presentation in July of 2023. Note 2020, 2021, 2022, and 3. And here is the interesting thing. This line, this dotted line, was the hottest day ever recorded till that time. Right? This is not special, it was just every day. This is literally from Twitter, or what used to be Twitter. So hottest day ever recorded is right here. On July 3rd, we beat the record. You tweet. July 4, we beat the record again. You tweet. July 5, the record is matched. July 6, 7, 8, you're back to the dancing cat. And every day in that month is hotter than the hottest day ever recorded since we were recording temperature, right? Again, I'm not trying to be facetious. I'm saying I don't need more data. I'm sorry, I really don't. You need more data. I don't need more data to prove to me that something is happening. I need data now for something else, right? Again, this is May of last year. If you were in California, if you were in Europe, if you were in South Asia, this is what the planet was looking like on the 24th, between the 24th and 26th of May, right? And I'm not picking, I honestly am telling you these were dates that I just happened to be presenting, so I picked something close by. In that spirit, what is the world looking like today? This is not today, this is last week. The latest data we have is for about 4 days ago. 24th of August, this 24th of October, sorry. Right? 5 days ago. This is what the planet looked like. This is not that it's very highly heated. This is what it's above the average. But the more interesting graph, and I can finally give you some good news, this will not be the hottest year. Last year was. If you look at that graph, this is literally data as of 4 days ago. That red line is the current year. You can see it in October. The orange line is last year, which actually was the warmest. But the most important thing are those dotted lines. That's where the average is. So a good year is so far above the average that just the meaning of average has changed. Raise your hand if you are 40 years or less in age. Anyone who's less than 40 years of age in this room, congratulations. You have never in your life seen a year that is cooler than average. Breathe that in. Anyone who is anyone who was born in 1985 or afterwards has never in their life seen a year that is cooler than average since we've been doing this, right? And again, this is not to scare you. This is just simply to say it is immediate, as if the point isn't made. Here is a simple graph. You've probably seen it before. Every month, what the temperature for that has been, global temperature. This is global temperature. And what has been happening so that you can kind of breathe in what the 1.5 mean, right? This is, again, not a prediction. This is not a projection. This is not what may happen. This is what has actually happened for every year since we've been doing this. The clock stops at 2023. You can see you're kind of hitting 1.5. That doesn't mean we've crossed it, right? Because it's a little more complicated than that, but not too much more complicated. Now, you're saying that's fine, but I don't live on the whole planet, and the weather today is yucky, but last week was actually pretty nice. Right? So how does this impact me? Choose your place, same data, put on the map of the world for every place on the world that we do have temperature for since we have been measuring it. Right? So choose wherever you want to focus on. And you can see the clock there, 1922, 1934, 1942. Again, essentially belaboring this point, climate is no longer a future issue. Not to scare you, but to say that, you know, this thing that we will do something is no longer relevant. Climate will do something to you, whether you like it or not, and then you can respond. Right? That is the change, that is the biggest change that has happened in my life. If that is so, that is what brings us to what I've been calling the age of adaptation. And where does health come into this, and how does the world change? Very quickly, let me talk about that, and then I promise to shut up. What does the age of adaptation look like? It's here, it's now. That's really the point I'm trying to make. I hope I've tried to get it across. And this point that I was making, that in the age of adaptation, climate change is not just a carbon management problem. Right? So this carbon obsession, well, is exactly right. We have to keep doing that, because carbon is what does emission. Right? But impacts are nearly not about carbon ever. You can't do much with carbon on impacts, right? Then you have to deal with health. Then you have to deal with water. Then you have to deal with food. And the big lesson of the age of adaptation in a very broad sense is that climate, as we've been talking, becomes larger than CO2 management, right? Larger than carbon management. Let me just give you a few examples, and I won't go into all of them, but I'll start with a few. This one is actually one of my favorite ones. Right? Not just because of the WWF connection, but climate and nature. We sometimes forget in our arrogance that we are not the only ones who are going to be impacted by climate. Right? Most of nature is going to be perfectly fine here, not perfectly fine. It's going to be here after us. They were here before us, they'll be here after us. So when climate changes, the impacts are not just on you and me. They are on those bacteria, they are on the soil, all the examples that you were talking about. And my favorite picture is this. If I were to say to you, what would be a picture of climate and nature, what would you give me? What would most people think if I ask you for a picture of climate and nature? Polar bear, right? A lot of my WWF colleagues love that. I also love that picture, right? There's a slab of ice, there's a polar bear, middle of the ocean, nothing till far off. And that is the picture we have. That picture is a lie. Because that picture gives you the sense the polar bear is waiting for you to come and save it. In my capacity as president of WWF, I have spoken to a number of polar bears. They are not waiting. They have no faith in you. They tell me that these guys can't even save each other. And they think they're going to save us. Our credibility in that part of the world is not very high. Really. The pandas kind of feel the same way about us. So that is not how nature reacts to change. Nature reacts like this. What happens when a mosquito bites you? Your first reaction is, even before thinking, nature does exactly the same thing. That's why this is a better picture, and an even better picture is this beautiful looking guy. Right? This guy is the Lamborghini of the natural world, right? Fur coat, straight lines, sleek. In this room, people would recognize this guy. Who's this? Oh, wow, you know this guy even better than me. I was looking for something in English, right? People say mosquito, and then I say not just any mosquito. This is my friend, the dengue mosquito, right? And the dengue mosquito is a good example because it's not the only reason, but we see the dengue in places we are not supposed to see it. Right? I was vice chancellor in Lahore, and we had to close down the university because of dengue. And there's no reason for dengue to be in Lahore. It should be in Karachi. People don't know the geography of that. It's near the tropics. Now you're finding it on the foot of the Himalayas. Now, partly it's because people like me travel a lot, and we take things with our shoes and so on and so forth. But also partly, the dengue adapts the same way as you do. We may be super adapters, but others are adapters too, right? So vector-borne diseases. And again, you have heard much better people than me talking about it. That's where climate and health, for example, become important, amongst other things, right? So water. Water is, if you remember any slide, I hope you remember this one. There is a major flood in Pakistan right now. There are literally millions of people flooded. It's not making the news, and that's fine because it's not even making the news in Pakistan. This is the 10th consecutive year of a super flood. You heard a bit about the one 2-3 years ago in 2022. This picture is what a flood looks like. For you who work on infectious disease, what do you see? If I were the business manager for infectious disease global, I would love this, right? You have the best environment in which to flourish. That's what a flood looks like. And the reason I put that is because this picture actually is from 2010. I'll move from this. This is all the fresh water in the world, which is plenty. But if you remember anything from my talk today, it is this line that will come up. Water is to adaptation what carbon was to mitigation. If you are young and you're looking for a career in climate, let me tell you, water is the next frontier. Water is to adaptation what carbon was to mitigation, and here is the reason why. Think about impacts, right? When climate changes, what happens? A lot of what happens is wet. Climate changes, water disappears, drought. Climate changes, water rises, sea level rise. Climate changes, water melts, glaciers. Climate changes, water falls from the sky like no one's business. Extreme events and floods. So water becomes the front edge of climate impacts, right? And that's why you hear a lot about it. And again, I do not need to bring out what this means for infectious disease. But very, very quickly, I'm sorry I'm going long, but I'll shut up. This is actually an older map that I did. Our Department of Earth and Environment used to be called Geography then. And this is 2010, the floods in 2010. The current ones are bigger. All you need to know is that's Pakistan. Just keep focus on the blue area, right? The blue area is where the flood is. So we were trying to raise money to help the people in the floods, right? And as I said, now we've had 10 consecutive years of this. And I was finding it difficult to explain to people what a flood looks like. Because I say flood and they think basement, right? And so I took this squiggle that is the blue and to scale put it on a map of the US. That's the size of that flood in this one country, right? From Vermont down to Florida. I put it on a map of Japan. You can't see Japan. To scale. I put it on a map of Europe. Right? And this is what I meant that the politics and policy is bound to become more difficult because when you had people are good. When you had the 22 flood in Pakistan, at the same time you had fires in Canada, you had heat in Los Angeles, you had people dying in Australia, you had a drought in Africa, right? So one of the things that climate does is that even if people feel for it, there are more and more of these to manage. That's where the contentiousness comes in. So if you remember anything, I won't talk about that for time reasons, but if you remember anything, water is to climate adaptation what carbon was to mitigation. If water is important, right? And I haven't brought out disease because it's so self-evident, right? But if water is important, then immediately food and climate becomes the thing because what is food except nature's way of packaging water, right? Not really, but to a large extent. That's how nature packages it so that we can move around with it, right? And again, for time reason, I'll go. The next one also for time reasons I will, but I do want to make a point. Energy, I actually don't worry as much about it. It's been one of the good stories. The energy transition is real. The energy transition will happen, is happening, right? That's how sort of that bending in the curve that I was talking about. Again, in my country, Pakistan, something really amazing happened last year. People internationally started noticing that the grid was just not producing energy. And it became so bad that the government had to put nearly a ban on solar panels, because the price of energy went so high that people started putting solar panels and the power plants had to shut. Right? That's where the change is partly coming from. So the energy transition is real because the economics of energy transition is real. Again, I don't need to talk about it, just the pricing and changes it, right? So that's a train I don't think any politics is going to stop. But the reason I put this up is the picture at the back. In the age of adaptation, you have a duty, I have a duty to also think about the 2 billion people in the world for whom the energy problem is not that they use too much energy, but they use too little, right? Because in our mitigation world, we've been trained to tell everyone use less energy. There are 2 billion people for whom I need to tell them, please use more, because they cannot get human dignity with what we have, right? Same with mobility. We all think of mobility and climate, but we think immediately of Tesla. Where I come from, the mobility problem is not Tesla. The mobility problem is this, right? That's also the mobility opportunity, right? This, by the way, you can immediately see the infectious problem if you are trying to hold down an infectious disease on that train, right? These are not AI pictures, these are real pictures. So what I'm trying to say is the problem complexifies for us. I know I'm rushing and I apologize for that. What is that picture? Well, I've put the word there. Does anyone remember, recognize this? This is a beautiful artist's rendition of what? Sorry? Waste, but what type of waste? Let me give you a close-up. So that's a close-up of the same picture. What is that? That's plastic water bottles. That picture at the back is 2 million plastic beverage bottles, a number used in the US every 5 minutes in 2007. If you are from a developing countries in this room and feeling smug, please don't, because we use the same or more, right? But here is the plastic issue. One of the worst things, one of the saddest things that happened in this year was the death of the plastic street. I spent a lot of time working on it, and it really pains me that what we could have done, we didn't. Here's why. We're a campaign organization and a communication organization, so we try to put it out there, and people might quibble with whether it's exactly a hanger, and if so, which hanger or not. But here is what no one quibbles about. There is not going to be a single baby born on this planet anywhere on this planet, whether they've flown an airline or not. There cannot be a baby born today anywhere on this planet who does not have plastic inside of them at the moment of their birth. Breathe that in, right? That's the world we've created. There are other sorts of things that I won't go into. Plastic is actually, there are many good things in the sense that it can also go out, but what it does or does not do as a carcinogen is still up for there. I was running a meeting for ministers at the, we were hosting this meeting, and the French minister said something which I'm sure is nearly certainly wrong, but what he meant is exactly right. I think his number was exactly wrong. His meaning was exactly right. According to him, in 2070, there will be more plastic than fish in the ocean. I'm not sure that number is exactly correct, but the intent, which is that there is just so much of what we use that is going to end up there is important. So again, I have overused my time. Ecosystems I don't even need to talk about and what they do and when those fires happen and what happens to health, etc. I do want to take a minute on these last two ones before I shut up. One is refugees. Right? And we are already clearly in the now clear world where environmental refugees are a reality. They are a different sort of reality. Environmental refugees are not like disaster refugees, right? There's an earthquake, you lose your home, and you go and sit in a tent. That's not how it happens. What happens is much more likely to be something happens because of climate or otherwise, flood, drought, whatever, your livelihood goes down. And because you cannot make your livelihood, you are forced to move out. When you're forced to move out, who moves out first? The strongest, the youngest, right? You go out somewhere. And one of the places where it has actually been happening now for over 15 years is the Sundarbans. Sundarbans means beautiful forest. These are the mangrove forests in Bangladesh. And around that are these small communities of shrimp cultivators, right? And the shrimp lives at this place where salt and fresh water meet. Micromillimeter changes, and I'm talking now already 15 years ago, micromillimeter changes in where the fresh and salt water meet means the shrimp moves. These are small cultivators. Their boats can no longer go to where the shrimp are, right? Village after village, livelihood goes. Livelihood goes, what do? Right? You catch whatever you can, you leave your family there, and you go to the nearest big town, which is probably Chittagong. From Chittagong, you end up in maybe New Delhi and then Boston, right? Or wherever. But if we think about refugees and immigration and so on and so forth, and think about how this happens, and I won't even go through this story, which is actually a wonderful one, but don't have time, but I want to show you this. This is literally from more than 20 years ago. It's not exactly to climate, but it makes the point. So this is a picture from January 6, 1974. It's called the Parrot's Beak. The Parrot's Beak is this place, right? That's, if you think about this as the beak, right? And that in the middle is the country of Guinea, and on its two sides is the country of Sierra Leone. Okay? Keep looking at the color in the picture. That's January 6, 1974. Let me bring it forward. December 19, 1999. What happened? Right? You can see the color changing in the middle. A lot of the forest is being cut. Why do you think that happened? There was a war. Where was the war? In Sierra Leone, the place that is green. Right? No one likes the war. I move from my war to where there is no war. I put pressure on the natural resources. Right? So the point I'm trying to make is, as we think about climate and refugees, we have to think about it in different ways. What pleased my heart, this is really the last of these, and then one more slide, and then I'm done. What pleased my heart was how much was talked about heat, because that's my biggest hobby horse for the last decade. And I actually apologize for the pictures you're going to see, because you shouldn't. But heat is also a very different thing for a lot of people than we were talking about. It's not about air conditioning and fans. And the reason it's my hobby horse is it is such an easy problem to solve, or at least make better. Right? I come from Pakistan. Right next to Pakistan is India, and then there's Bangladesh. In the city of Karachi, there used to be 4 seasons. Now there are 5. I can tell you exactly when the 5th one will start. I can tell you exactly when the 5th one will end. I can tell you exactly that about 600 people will die in Karachi. And I can tell you that that 5th season is called extreme heat. And the same is true in that belt into Mumbai and sometimes nearly to Dhaka. Right? It is not so extreme that it will show up in our graphs, but for real people living real lives, particularly for people who are at the lowest end of the economic stratum, usually are homeless, they are the ones who are going to suffer because, and the reason I say it's a solvable problem, the solution is 2 things, shade and hydration, water and a tree. Right? So this is for every major city. It's not just because of climate change, it's because our cities are made out of concrete. But what it leads to is this problem that is now so systemic. This is not future. I'm giving you actual data from actual cities, right? And these are cities with 15 million people living in them, right? This is not a picture you should see. This is not a picture we should be having to see, and you see this again and again. And again, the solution is so simple: hydration and shade. So plant some trees and make water available. And I apologize for this picture, that those white things are unclaimed bodies that are about to be buried in a large pit. Because it's been too long for them to be unclaimed, and the people who die. And again, as I said, the poorest will suffer, as you've seen that the same in Europe, are usually migrants who are working outside and therefore also don't have the support system and so on and so forth. So the point here, if there's a good part of it, is that there are things to be done, and they're not very difficult things. Let me end. This one really is the last one. How can climate change How climate change is changing how we respond to climate change, or how should it? 4 things, I would say, none of them easy. I should have said how it should, because it is not always. 1, we need to move our thinking about climate change from thinking about climate change as mostly energy to thinking about climate change as nearly everything. Not in little holes. I work on health, so I'll do a little health and I'll do this. But what Benjamin was talking about here, this holistic thing, right? I would love to talk about Bill Gates' article. I've spent all morning talking to folks about that in 4 different continents. But that's what he doesn't get apart from other things. But the compartmentalization is no longer working, and we need to think about it in that sense. The second, and this may sound technical, but it is not. This is where health is. We need to think about finding solutions that maximize security to finding solutions that minimize insecurity. I've purposely chosen those words because I teach international affairs, but health is exactly the same way. In COVID, we were maximizing security. The vaccination is, I will now give you security. Minimizing insecurity is tackling the conditions that make people vulnerable. Right? This is why loss and damage is such a difficult problem. If you wait for loss and damage, you really can't do anything except maybe bring them back. Right? This is the prevention versus the disease problem. And that has to be done across a whole set of issues. And this is why adaptation can be an opportunity. Right? Give people livelihoods, give people decent life, and they will create the conditions in which these threats will threaten them less. Right? That's why I put the heat part up. Policies that maximize security target bad behavior. Right? You can see this in health all the time. Policies that minimize insecurity target good behavior. How can I encourage people to behave better so that the bad things don't happen? The third thing that I would argue is, and this is really difficult. This is really difficult, particularly in this world today. Moving from thinking international to moving to thinking global. This was always difficult. It is particularly difficult in today's world. Those are 2 separate things. The logic of the COP, this is why they don't work. The logic of the COP and of international agreements is all of us countries are going to come together. You're going to seek what's best for the US. I'm going to seek what's best for Germany. You're going to seek what's best for India. You're going to seek what's best for Japan. And somehow, by adding all of that together, we will come to what's best for the world. There is no math that works that way. Right? What that leads to is the lowest common denominator. Right? That is why we've been stuck with climate policy. That we have thought as nations rather than as a species. Right? This arrogance that we have that we are special. There's this, I know I'm running out of time, but allow me, there's some other planet, there were these 2 creatures, they were looking down through a telescope on this planet of ours, and one said to the other, hey, there's something interesting happening there. And the other says, what's happening? And he said, these guys seem to be smart. They've invented something that they can send a bomb from one side of their planet and it'll land at the other. And the first one says, are they an intelligent species? And the answer is, no, not really. They're using it to kill themselves. Right? But that's a rather profound thought. And that's why this is important. And the last of these is we need to move from thinking about adaptation as a problem to thinking about adaptation as a solution, as once in multi-generational opportunity to put things right. When we think of it as a problem, we think immediately of economic cost. When we think of it as an opportunity, we start thinking from social justice. My apologies, Nahid, for going on and on and on. As you can see, I love my own voice, but I am so glad to be here. Thank you very much.
So you can see why Adil was my favorite professor. Can we just give him a big hand? Wait, don't go yet. I figured out the solution, the communication solutions to climate change. We saw Adil Najam everywhere, and he talks about climate change. I will say one thing, that map of Guinea and Gekadu, the impact on disease, I want to point that out. That is the area in Guinea from which the 2014 West African Ebola epidemic emerged. In 2013, the index case was in that area. There's a lot of interaction between humans with bats, with fruit bats in particular, that live closer and deeper into the forest, which led to the index case, which led to the spread to 3 countries and many other exportations. So direct connection between infectious diseases and climate change. I think we do one question because I cannot deprive you of the opportunity to ask Adil a question. So we'll do that, and then all this amazing food that is making my stomach growl will be attacking next.
And my apologies for going on.
No, this was amazing. No. Questions from the audience? We have a question there.
Thank you. Thank you so much for that talk. Given the welter of misinformation and disinformation about climate change, how do you speak to folks who think that this is a hoax, that it is just a conspiracy of liberals against everyone else? How do you address them?
You want to take another question and I'll shut up? And I will answer that in one line. So that
one more, please.
Yeah?
Yeah, let's do one more, and then we can answer both together. Any more?
Okay, not?
Oh.
Okay.
Yes, I was curious about potentially the implications of the interconnectedness, as we heard from the panel, as you mentioned, like the water crisis, the food crisis, and how it relates to infectious disease outbreaks. I just wanted to see if you could maybe elaborate a little bit more on that.
Yeah. So I'll be very quick on both. On the second one, again, these are great questions. These are really great questions. And as you know, if someone says they're great questions, that means they have no idea how to answer them and are just fishing for time. So I have no idea how to do that. I wish I did. But I do think that this last slide that I had about going back to development, right? That in some ways, I honestly believe that we need to reframe our goal as being problem-driven to being solution-driven, right? We created climate change as a problem, and we have spent lifetimes, I have spent lifetimes scaring people. I'm really good at scaring people, right? And I think young people are just losing it with me. My daughter is, because you can't scare people forever. It's like going on a long journey and there are kids back at the car and they're saying, are we there yet? Are we there yet? Are we there yet? Right? It's really annoying, but at some point that's the right question. I think young people are asking, are we there yet? And I don't think we need to lie to them, but we can say, we are not there, but we are making progress, and then point out where the progress is so that those changes can happen. And a lot of the progress happens through what I call development. Give people a good life and they will, give people dignified and decent life and they will make better decisions, including in that situation in the refugee camp, including in how they use water and so on and so forth. That's what I mean by putting it together as opposed to. How do I talk to people who think it's a hoax? That's an easy one. I don't. There are enough people, and I'll come to that in a minute. This is a flippant answer. Unfortunately, your question has become much more serious in the last year or so. till before that, I could have honestly said, for most people, most often, I don't find those people, or they don't find me, because that's a particularly US problem, or has been generally a particularly US problem. It's not as rampant the rest of the world in denial terms, right? In inaction terms, there's a lot. But, so I don't know how to really deal with them. There is a type of denier who is not interested in discussion. And there, I think, not discussing is fine. But there are a lot of people who we think of as deniers who I think really want the discussion, right? And part of them are pushing us that we are making climate look very difficult. I'm being absolutely honest now, okay? This is me speaking for myself. We have made it, sometimes we make it as if doing the right environmental thing must necessarily make you uncomfortable. Right? The solutions that we give are do not do this, give up this. We have made good climate action very costly. And I think the job for people like myself and others here is to now put things that actually show progress without necessarily giving that level of discomfort. The other end is also a problem one, because a lot of the things we've done actually don't have impact. So I'm babbling here, but I'm babbling because we need better solutions. We need solutions that demonstrate that the needle can move, but does not turn the world into villains. I would much rather look for heroes than villains in the world. So we climate folks also made a lot of people villains. Maybe I'll end with this, and I don't know if it'll answer your question, but it helped me when I heard this. Focus on the ones who are still committed to this and helping them do what can change, because that is what will bring them back, rather than your cajoling them. I don't know if I'm conveying this the right way, but not an easy question, and as I said, particularly difficult right now. But I would much rather focus my attention on those who do want to change, which I still think is the majority, and through them demonstrate that change and a good future is possible. On that happy note.
That is a happy note. Thank you so much, Adil. We'll bid goodbye to our Zoom audience, and for our in-person audience, please make your way to the reception. Thank you.